very vital topic, that is the importance of health education in primary healthcare. Communication, health communication has always been a tool for him to fight so many things. He had used it to fight for the for the poor people, for the marginalized, for those that are voiceless. So it is indeed great to one having him here to learn, because sometimes we feel like health education is only for those that are in the health system, that we fail to understand. Because if people are communicating on health issue, it reduces a lot of misconceptions in our communities. So health education is for every individual. You've been a banker, you've been a public health officer, you've been whatever, a computer engineer, whatever, civil engineer. It is for everyone, because everybody has a family and everybody gets sick. So having a very important topic to discuss with Mr. Njai, who has always been a very good person in health education. He has become an icon for the Africa, for Gambia, Africa, and the world. So it is a pleasure having you here, Director. So on that note, I wouldn't say much. We just go direct to the program. That is, we will have an opening prayers for. We'll have an opening prayer for 5 minutes, followed by welcoming remarks by the SG, the biography of the guest speaker by the assistant academic secretary. Then we will have the speech by the director, that is for 45 minutes to 50 minutes. Then question and answers will come next. Question and answers will come next by all participants for 10 minutes. And then we will have a closing remark by our able academic assistant PRS. So on that note, let us please have our individual prayers in our own ways for just 2 minutes, please. May I answer our prayers. On that note, we move to the next agenda on the point, that is the welcoming remark by the by the SG. SG, the floor is yours.
Yes, thank you very much, Adama. Thank you very much, members who were able to attend this meeting, this important webinar. Ladies and gentlemen, I extend my warm welcome to each and every one of you on behalf of the Association of Gambian Students in India, 7th Executive Council. Today's webinar, exploring the importance of health education in enhancing primary healthcare access in the Gambia, is a significant initiative. Our esteemed speaker, Mr. Modou Njai, brings a wealth experience as a former Director of Health Promotion at the Ministry of Health in the Gambia. His insight promised to shed a light on the critical aspect of healthcare, contributing to our collective understanding and betterment of healthcare access in our homeland, the Gambia. Let us engage, learn, and also collaboratively work towards fostering a healthier future for the Gambia. Mr. Modou Njai, you are highly welcome. This is Association of Gambian Students in India. Our dream is back home, but we can do it better if we were informed and if we have a platform also to be given to us as a nation. Thank you so much. You are highly welcome.
Thank you.
Thank you very much.
All right. Thank you so much, SG, for that precise welcoming remark. And the next one on the point is the biography of Mr. Modou Njai that will be read by Isa. Isa?
Okay. Hello, everyone. Okay. Good evening, everyone. Today, I'm thrilled. And are you guys getting me?
Yeah, you can go on, please.
Okay. I'm thrilled to take you on a captivating journey through the life of a truly remarkable guest of today's webinar, that is Mr. Modou Njai. This biography unravels the tapestry of Mr. Njai's life, offering insights into the moments that defined his legacy. So without further delay, let's embark on a narrative that promises to inspire, resonate, and illuminate the extraordinary path taken by Mr. Njai. Mr. Njai. Mr. Modou Njai was born on the 14th of April 1972. He obtained a West African diploma in public health and environmental health from the Gambia College School of Public Health. He also passed through the International Agricultural Center in the Netherlands, where he obtained a postgraduate diploma in food and nutrition security. He also has numerous certificates, certificate in participatory communication methods and approaches, and participatory development concept tools and application of PRA or PLA methods from International Ottawa, Canada. He also has a certificate in cardiovascular health and chronic disease prevention in sub-Saharan Africa. That is on a seminar on cardiovascular health promotion and chronic disease prevention in Accra, Ghana. He has Master of Science in Public Health, that's health promotion in Leeds Metropolitan University, and Social Policy for Development Planners, that is Certificate of Competence in the United Nations Africa Institutes for Economic Development and Planning, Dakar. Mr. Njai also has wealth of experience in the area of health. He was a district public health officer at Sami Karantaba Health Center, Forafenes Health Center, Environmental Health Unit, Banjul Indian Health Center, and Banjul International Airport. That is as Port Health Officer under the Minister of Health, the Gambia. He has a he was a Health Education and Promotion Officer under the Minister of Health. He was a Hygiene Promotion and Education Coordinator, Rural Water Supply and Sanitation Project. He was a Hygiene Promotion and Education Coordinator, ADB Climate Smart Rural Water Supply and Hygiene Development Project. He coordinated the multi-sectoral working group on non-communicable disease and tobacco control. He was a program coordinator in the integrated management of neonatal and childhood illnesses under Minister of Health, the Gambia. He was a director of health promotion and education under the Minister of Health, the Gambia. He led the establishment of the National Health Promotion and Education Directorate and Minister of Health with required human material and financial resources. Currently, Mr. Njai is National Coordinator, Saving Lives and Livelihood Programs, and Africa Center for Disease Control and Prevention, Regional Coordination Center, Abuja, Nigeria. Mr. Njai was also a part-time lecturer at the University of the Gambia College School of Public Health, Leeds Metropolitan University, and Wageningen University in the Netherlands in the area of health. So thank you so much, Mr. Njai, for taking your time and graciously accepting our invitation to share your insight and expertise with us. We truly appreciate it. Thank you.
Thank you so much.
Yeah, thank you very much. Thank you.
Yeah, thank you so much, Isa. Thank you so much for that rich biography. I just hope when I grow, I will have such a rich biography. His biography touches almost all the four corners of health. You've been a neonate, you've been a youth, and everyone. So it is just a rich one and inspiring one. Ms. Njai, we hope to be like you one day, inshallah. Or before going further, I would like to acknowledge the presence of some of my colleagues. That is Mr. Lamin Samu. We work at the same office where Mr. Njai was the director, and our employment was because of Modou Njai. We were employed when he was there during the COVID time. He really fought for us to be there. We were 12 members from the Gambia College School of Public Health, and we were selected by merits, which had brought a lot of chaos in the ministry. But he stood for us. He stood for the voiceless. He stood for the poor, and now we are there because the reason why he stood for us was many people thought we cannot do it. We are young. We are just from the college and so many stuff. So what he understands is not about the age, it's not about where you are coming from, but it's about the heart and what you think you can do for the country. So he really fought for us to be there. Now we are there to the extent that so many of them are doing so great things, to the extent that even the minister is now realizing and commenting on that. So in doing that, he does not only fight for the voiceless or fight for us as individuals, but he also contributes to national development, because those people are people that today are contributing in national development in all the four corners of the Gambia. So thank you so much, Director, for giving us the opportunity to prove to them that it's not all about the size. It's actually about the heart or the love that we have for the system that is the health system. So Lamin Sambu, it is a pleasure having you here, and I'm saying namaste to all the 12-man squad, including myself. Thank you for having you here. On that note, I think we can just go direct to the program. That is the importance of healthcare, health communication in primary healthcare. Mr. Njai, the floor is yours. Thank you.
Thank you very much, Madam President. Thank you very much, colleagues, and good evening, good afternoon, and good morning from wherever you may be, and greetings from the Federal Republic of Nigeria, Abuja. We call it the federal capital. That's Abuja is the federal capital of Nigeria, out of the 36 states. So Nigeria, Abuja is the 37th state of Nigeria. So greetings from all corners of Nigeria and the Gambia. I am very much happy to be part of this exercise, although I think Adama and colleagues, really, I want to thank you for identifying me to share my experiences in the area of health education and health promotion across the country. Although I have not been feeling okay, but I said, based on that, and I still appeal that I should still take the responsibility, but I'll be very sorry that time to time I'll be coughing because I have a very bad cold, and then time to time I'll be coughing, so I have to apologize for that. But nonetheless, this is more important to me than the condition I'm currently in, because really sharing my experience for me is one of the most important things for me than anything else. So I want to thank you very much for inviting me to this important exercise. Basically, I have to discuss, when we are discussing about health education, perhaps we need to know what is health education first. And also we talked about primary healthcare service. And what is primary healthcare in general, and what are the key principles of primary healthcare, and perhaps we also discuss some of the key elements of primary healthcare. Then now we can be able to now link the health education importance to primary healthcare service delivery in the Gambia. So this is how I want to discuss. And then unfortunately, I didn't prepare this statement because I've not been feeling okay these days, but nonetheless, I can be able to share the little experience I have. Some of you really are more experienced than me, and some of you also, I'm praying and hoping that all of you are going to surpass what I have achieved in this country. That is the only way we can be able to develop the country. And I've seen those signs in the young ones that are coming to the Gambia College. As Adam rightly mentioned, their team is one of the teams now the entire ministry is relying on. So if they were not in the ministry, what is going to be the situation of the ministry at this point in time? So I am very much I'm happy, and I'm vindicated that they have proven to everyone that they can deliver, and they have done it, and this has been demonstrated by them, and I want to thank them for the commitment, and they have demonstrated during the COVID time, which they came at the time, there were no resources, there were no funding, but they were able to work and even sleep in the office just to make sure the communities are definitely supported in terms of getting the required information. Basically, health education, we will just look at it in a perspective of sharing health information across the population. It's a profession that is within the public health care, that is within the public health profession, that is responsible for sharing health information. So you share health information to the public, and this is done through many ways. We will discuss it in some of those ways, and then the ways are, for example, we are using 3 main approaches in health education in the Gambia, and this is what we have been doing. But at some point, we normally also work on that, reviewing it, and also expanding those strategies and approaches. One of them we use print media, we use electronic media, and we also use traditional media. So when we talk about traditional media, I have to now start with that. Because when we talk about traditional media, we talk about the Kanyalengs. I know some of you are from the villages. We talk about the Kanyaleng, the traditional drama groups, or the Kanyalengs, you may call them. And these are individuals, these are in the community, and then they create these are imaginative songs, and then they can also be able to use that in the form. They disseminate the messages using songs. And then when you talk about the drama groups also, they are about either 10 in number, and then they also are able to come together and dramatize the information that we are giving them, and then that is how people also get the information at the community level. Like these drama groups, we have them across the country. We have trained 150 drama groups across the country, and then these are spread across the country, because we're also considering the fact that one of the principles of primary healthcare is equity. We need to make sure that our work goes across all the sectors, across all the communities. We cannot say we are dealing with health. We are not. We are, for example, excluding a community of Misraba Mariam, for example. Maybe because they are very far, or maybe when you talk about communities like I would say Fode Kunda or Baja Kunda, Yorabawal, or these are communities that are far, and you say, oh, they are far, let's forget about it. No, we said no. In health, we make sure that we go to all the communities. Our function costs across all the sectors. So we train drama groups across different locations. And these groups are when people need them. And up to now, agriculture uses them, Ministry of Education uses them, and health also uses them. And then they are 10 in number trained and they're in the community, and they perform in the communities within the cluster. So when we train them, what they do, like we give them the messages, we train them, we rehearse them with them, and they also dramatize it. And we also look at their drama skills and their performance. And based on that, when it is approved, then they can use that skills and drama performance to go to the communities, talk to them, dramatize the information, and these are the ones that's how they are able to get information. And people get that information very clear. They will tell you, we get our message from the community drama group members, and that's why we are able to come to the health facility to seek for healthcare services. So this is very important. One of the areas we have succeeded was that. We also identify key among them also are the traditional communicators. These are the Kanyala youth. They are also, some of them are also part of the drama groups. Some of them are either in communities that do not have drama groups. So they also do what they call songs, they portray and also carry, use the messages using songs in the community. So that is why you will see that we have these numbers also. We have about 1,500 of them across the whole country, covering all the regions in the country and covering all the districts in the country, because we don't want to miss any district. We don't want to be biased towards any community. So that is why we have them across the whole country. So when we also have the print media, for example, we use the journalists, we also use newspapers. And then we also, like, for example, when we have some information, we want the information to go to the communities. Like, for example, the case of Ebola, we want the information to go to the community to be able to prevent themselves from the disease. We were able to use the print media. We had the newspaper. We also had press briefings. And these press briefings, when we do what we do, we come up with a topic, and this topic will be discussed, and then we'll be asked by the journalists. And as they are asking, we also respond. So what we also do, we took our responsibility. We don't want to run away from the media, because we know that the media is very, very key. So that is why we, as a ministry in 2001, in July, we were also able to support the Association of Health Journalists to establish an association. And this association is just, they are using that to send information. Because what was happening before 2001 was that people at the ministry were very much scared of the media. They were between them and the journalists, just like cat and mouse. They don't want to be close to each other, because there was always that blame game. The journalists will come, start blaming the health sector staff, and the health sector staff will start blaming the journalists for reporting something that they're not supposed to report. So when we realized that, we said there is a need for us to train these journalists on health reporting, and that was why we had. After the training, they came to them and they said, we want to form an association, and this association really, since its establishment in 2001, we have been having smooth relationship with the media in terms of health reporting. This is also another way of getting information to the public. We also have I'll talk about the electronic media. The television is also the radio. We have also been using the Radio Gambia, and we have also started using community radio stations across the country. These community radio stations are located they were 10 in number, located across the country. Some of them, we have one in Brikama, for example. We have one in Brikama. So all those community radio stations were as a result of getting the information to the public, to the communities. So these communities, so that we don't want to see the Gambia at the time in Banjul and also in Basse. But we said we also need to have these community radio stations, so that they also serve as sort of a medium for the community members also, because we have programs in local languages, and these local people, communities will come from the community. For example, like community members, like key influential leaders, religious leaders, and other leaders in the community will come and then talk to the radio station and talk to the language that the community members will understand, and that has really helped us a lot in getting information filtered to the communities. That was also very, very important, important approach we have used. So in short, in primary healthcare, we know that primary healthcare communication or health education is one of the essential pillars or essential elements of primary healthcare. So therefore, we have also emphasized that community members should also be able to get the information at the right time. So we know that when information comes, we don't want the information to only come from the central level, or in Kotu, or in Banjul, or from the regional office in Basse, Bansakonko, Bansang, and others. So we said, let it also come from the committee members themselves. And that is why we also were able to establish, we were able to create a position for regional health promotion officers to serve as liaison officers between the committee, between the directorate in Banjul and the committee members, and this has also proven very possible. And today, most of the programs in the health sector are relying on the health promotion officers at the regional level. So I say bravo to all of us who have been part of the process of establishing these structures at the committee level, and then also having this committee drama group. Even yesterday, or was it last week, one of our colleagues in URL had a program, and then the drama groups there, and the Kenyans were there singing and even singing about me. And they said, but these people have still not forgotten you, because some of these drama groups, what we did was we make sure that workshops, we give them what they are supposed to get. We give them their per diems, we give them their transport. When we meet them, they will tell us that the workshop you invited me 10 years ago, I was able to at least pay the school fees of my children, or I was able to do A, B, and C, and today those children are somewhere else, and they're really benefiting me a lot. So this is something that we feel we have done, and we have done positive changes to the life of the people in the communities. So that's something that we also were able to do. So when we talk about the primary healthcare, I talk about the essential elements of primary healthcare, but before that, we'll talk about the principles. I said we talk about the principle. One of them is the equity, to make sure that we have equal services that are offered to the community, no matter where they come from, no matter their location, no matter their political affiliation, no matter their tribe or whatever. We make sure that everybody is equal in the healthcare information we are providing to the communities. One also key cardinal point I miss is the issue of the call center we have also created within the ministry. And the call center, I can happily say that one of the pioneers of the call center, Adama, your president, is one of those people who pioneered the call center we have established, because when we established it, nobody was willing to work there because it was based on voluntary services. So her colleagues and herself were the one, Lamin Sam was one of them, they are the ones who came together and said, Director, we'll be willing to sacrifice and work here on a voluntary. So based on that, they were also working there, sleeping, and they're also getting information. People were calling. At the time before we had the COVID call center, we had the Ebola call center, and my number was the one that was given. And then every day I received calls from morning to the next day. So we are only two in number, myself and Modou Njai. So we are the ones who've been called, and we had so much trouble. Even you cannot sleep, you cannot rest. Calls were coming. So when COVID-19 came, we said, no, let's try to get a call center. Let's try to get the staff. And when we opened up this staff, and we had volunteers coming, and these are the Adama is one of those volunteers that came to volunteer, and Lamin Sambo and team. And today, that call center is the backbone of the Ministry of Health in terms of getting information to the communities and also getting information from the communities to the Ministry of Health. We have the feedback mechanism. And that's why communication is very key. We said communication is a two-way process of sharing information in which there is a need for feedback to be available on time. So that's why the call center, when people call and they are given the information, and we also catalog this information depending on the category of the information that is coming in. For example, is it related to COVID? Is it related to personal issues? Is it related to bonds? Is it related to now the COVID? The call center is now covering all aspects of health. So we have been getting calls from the communities, and then that was our objective, to empower the communities. Because primary health care is all about that. It's all about intersectoral collaboration, equity. It's always talk about some of the areas like appropriate technology. The appropriate technology we have also done, like some of the training, we also give them mobile phones, and then they can also be able to call if they are able to. Like now, some of the programs in the ministry are also relying on those people now, giving them the information, and when there is a need for referral, for example, they will call the facilities that the health workers are going to, and then they also get the laboratory or the team prepared before the arrival of the patient. So you can see how we have been moving from the lower level up to the level that at least each and everyone understand the information sharing with regards to health. So a lot has to happen, but a lot needs to be done. That is one. The issue of primary health, the issue of health education, health promotion needs to be prioritized. If it is not only talking about talking about health education, health promotion, and most of the time, our experience, we are only recognized, we are only consulted when there are problems and when there are challenges. Like, for example, there is a need and they expect us to do miracle. And this is the only disadvantage of leading a communication team, because in most cases, you are not given budget, you are not given the required budget, you are not given the required resources, but you have to do things on your own. But when things come, the blame is always put on the communication team for not doing A, B, and C, not knowing that communication is not being prioritized at the beginning. And this has been the challenge across the globe. You talk about my colleagues in East Africa, my colleagues in Southern Africa, my colleagues in North Africa and others. This is exactly what they are all complaining about, that communication is not being prioritized. And then I hope and pray that some of you doing some of these courses, and you should we will be able to at least talk to our governments, our ministries, our colleagues in other departments, that the communication should be prioritized. And we have also seen the need for communication. Like some of the ministries, communication is not done on time. And that's why there's always rumors. Some things will happen, communication is not done, and people have been speculating. And the moment people speculate and information doesn't come at the right time, people will also start spreading rumors. And when the rumor is not being handled and tackled, obviously, you are also resulting to chaos and pandemonium. And this is what is happening in most of the departments. And then we also start doing what we call firefighting. And firefighting doesn't help in any case. And you will realize that in communication, less funding, less budget, and then less consultation, unless there is an emergency, then they expect the communication team to do miracle. This is across all areas of communication. So I think for me, when you talk about the issue of maternal and child health, you're talking about wash, you're talking about food safety, food hygiene, you talk about other areas like treatment of minor ailments and prevention of minor illnesses. Definitely, communication is very key. Health education and health communication is the number one pillar that should be considered. Otherwise, you cannot be able to achieve what you wanted to do in the life. So this, in short, basically, I would say health education is very, very important in primary healthcare service delivery in the Gambia, without which people will not be aware, people will not also be able to come up and seek for services. Remember that we have been having challenges in terms of healthcare seeking in the Gambia. We are not saying it's poor, but the healthcare seeking behavior in the Gambia is really something that one need to consider very well, and that is why, because people are not aware of certain conditions, they will not be able to do. But here in the Gambia, awareness is not an issue. It's the issue of now people taking the responsibility, people changing their behaviors to come forward to certain healthcare services. Because we talk about all the structures we talk about, we have been intervening. For example, recently with regards to the issue of I would say modern work, for example, the project that we initiated, that's the modern work, is the mid-upper arm circumference, which is done at the nutritional assessment of children in the community level. Like, for example, not every community that you can have a community health nurse. And then in our setup, when the ministry established the primary healthcare strategy in 1979, after the primary healthcare declaration on the 16th of September 1978, that's the Alma Ata Declaration, which was established, and government started implementing the primary healthcare strategy. And then gradually, and when the primary healthcare strategy was implemented at country level, the agreement was between the committee members and then the ministries were that committee members volunteered to support the village health workers and the traditional birth attendants then, before they are turned into traditional birth companions. But now it was traditional birth attendants, but now traditional birth companions. So before they change that one, now people they have been having information sharing, and then this is something that we have been focused on, and that was why in 1979 the CHN school was established by the Minister of Health. The idea was to train health workers to go to the communities, and then the community health nurses, these are the CHN village health services, they are based in a key village, and when they are based in a key village, they also oversee 6 to 7 villages within the cluster, and in each cluster there is a village health service, village health worker, and the traditional birth attendants, and he supervises these people on a monthly basis and get the information. So we know that nutritional assessment is not done in every key village. So the CHN where he's based, we decided to train community health workers, community volunteers in some of the communities, so that they can also be able to measure the nutritional status of their children in the community before they go to the cave village. And that is a way of also working closely between the community members and the CHMs at the cave villages, so that the final process can be very, very easy. So you can see our work cuts across all the primary health cares, levels so in the country. So this is so far in summary that we have been doing, and I really want to thank you very much. And sorry that I've been coughing because I had a very bad cold. So far, if you want me to talk, I can talk the whole day, because based on my experience, but I really want to limit myself to the importance of primary health care, health education for primary health care service delivery in the Gambia. In summary, this is what I can give you. Thank you very much, and over to you.
Thank you so much, Director. Thank you for that important and precise speech. It is really, I told you earlier on, like the power of communication lies on his hand. He have health communication lies on his hand. He have the knowledge. He know how to do it. He know how to express it and when to express it. So on that note, he also mentioned about the crucial points, that the crucial roles in primary healthcare in several reasons. That is, number one, it empowers people with individuals with knowledge and skills needed to make an informed decision in their health. Also, it helps in the proactive approach that can lead to preventive measures, reducing the burden of the healthcare system. Example, that will be during the COVID-19 pandemic. If health communication is done before the pandemic will reach to Gambia, it can reduce a lot of burdens on the healthcare system. But in case it was not done properly, it can also lead to dangerous stuff such as the high rate of deaths. So health education, the importance of health education cannot be underestimated, because it serves as the foundation of health system, that is being the primary healthcare, the secondary healthcare, or whatever tertiary healthcare. So thank you so much, Ms. Njai, for having you here. Thank you. On that note, I think we move to the next agenda. That will be the questioning and answering session that we have only for 10 minutes. And on that note, I would also like to acknowledge the presence of my Fadan, a colleague, and Yero Kante, also a colleague and a classmate. Thank you all for joining us despite your busy schedules. Thank you all. On that note, we move to the next agenda, that is the question and answer session for 10 minutes. If anyone has any question to ask, you can please raise your hand, and then the floor will be given to you. Thank you. I think I will have my first question. Okay. Ms. Njai, you have your first question?
Oh, you could have gone. Anyway, thank you very much for giving me the floor, and thank you to our honorable guest for those wonderful words. We really appreciate it. Yeah, looking at the bio this guy read, meaning that the director had gone through so many areas, and by his speech you can realize it. I have mentioned some important areas like the advocacy that they have been doing through the drama, journalist, radio engagement, and the likes. But again, there is a portion that concerns me. That is coming up as a child, we used to hear this word of butterfield. That is these health workers that engage in checking and monitoring foods. Now I realize there's this FSQA or FSQ1 that I think is now mandated to do that. What is the difference like? I believe before there was so much monitoring in terms of food and food vendors and the likes. Now that's a different case. People sell anywhere, anyhow. What would this suggestion about this changes? I think it was more of like it was more valuable then at that time by them monitoring it and now taking it to FSQA. I just wanted to know his idea about it and what's the switch, why this switch from them to FSQA. Thank you.
Yeah, thank you very much. This is a very important question, and it has always been coming in our discussion. I just want to say that there was an MOU between the Food Safety and Quality Authority and the MOH and the Minister of Health. And this MOU doesn't mean that it's only them that are supposed to do the inspection of food premises, but the inspection of foods was mainly the mandate of the Public Health Cadre according to the Public Health Act. So, but basically when, as you know, some politics came in, and then some feel that the powers of public health should also be reduced and also be given certain responsibility to other agencies. And that was because without them having certain functions, obviously the agency would not be able to function. That was why when it was established, there was an agreement between the public health and also the food safety. But this has been there has been some issues. Public health officers will go for inspection, and whereas the food safety also will tell them, no, you are not supposed to do inspection. So that friction is still there. Honestly speaking, I'm not going to hide that. The friction is still there. And then we are still, the ministry was still working together to get that understanding of the public health inspection is the mandate of public health officers. As you rightly mentioned, in the colonial days, it was the power of the public health officer that was more recognized than any other institution in terms of food inspection, environmental inspection, and that's why we had our name. Board of Health means Board of Health. The Board of Health is a body established to oversee the health of the population based in Banjul in the colonial days, and that was that board is that people cannot pronounce it like my Badabunkas and my fellow Kiankas will, so we couldn't pronounce, so we say Board of Health. So this is the Board of Health that was established to oversee the implementation of the Public Health Act in the country. So the Public Health Act, one of them is the inspection of food and also the inspection of environmental in the houses and so on. So that friction is still there. The food safety, they're also given them a mandate according to the law to do inspection, and but there are some frictions here and there between the food safety and the Minister of Health. And these are things that the discussions are ongoing to be able to address some of the areas, because like instead of public health officers saying food safety cannot inspect, or instead of food safety saying the public health officers cannot inspect, but we encourage them to work together to ensure that food is protected, food preparing and distribution premises are protected for the population. So this is something that we are working towards. And I've not been working there, but we are talking to colleagues now to see how we bring these two bodies together to ensure that food inspection is given priority. Because we are receiving a lot of complaints. And even when these complaints happen, the people point fingers to the Minister of Health, the public health officers. They will say, where are the public health? Not knowing that the law has there's a bit of change in the law, and then some of the mandates are not given to public health officers in terms of food inspection. But some of these things have been discussed on the table, and so with time, this will be discussed and agreed on. Like, for example, the issue of NANA, National Nutrition Agency, looking at the nutritional status of the population, which is an agency, but they are working together with the other ministries like education, health, and as well as agriculture. So this is something that we also want to encourage the food safety to do, which they are doing, but that also needs to be strengthened more so that the collaboration can be strengthened and people will understand that we are working together towards a common goal in terms of serving our population. Thank you. Over.
Thank you very much, Mr. Njai. Is there anyone else who wants to ask a question or make any contribution? Okay, Mr. Mo, can go ahead.
Yes, thank you so very much, Esa. Greetings, everyone. Greetings to Mr. Njai. Yeah, you are indeed, a motivation to all of us. Okay, my point is, I just want to ask this question, as somebody being born and raised in Farafenni, and many know Farafenni as a border between Senegal and Gambia, and a very busy border, but a very busy border also. So looking at the healthcare, usually the public health officers are always in the forefront when it comes to healthcare services in those borders, because it's a very busy border, and sometimes when there are disease outbreak also, these healthcare workers are one in the forefront. They'll be at the border inspecting people coming in and then going out, and that making them very vulnerable. But if you converse with some of them, what they will tell you is that they are not rewarded, meaning their remuneration is not that much encouraging, and the risk they are taking also is not paid for. So what is the cause of this? And don't you think this also this might also affect us at the end? Because of if you are not remunerating them also, people will not be ready to take that risk because it's very risky. They are at the forefront, meaning they are coming into contact with people that they know that they don't know whether these people are having the disease or not. But they'll be the first people to have interaction with those people, and at the end of the day, they are not remunerated. So how do you see this thing? Yeah, thank you.
Thank you very much, Mr. Bo. And I'm sure you may have heard a lot of stories about me, and I'm sure when you talk about Modou Njai in Farafenni, they will tell you the guy was not an easy person. And I was able to control my Farafenni with my team Dr. Bua Manjang and Dawda Lee, we were able to control the place in terms of environmental inspection, in terms of bakery inspection, in terms of meat inspection at the Abata. We were able to control that from 1997, 98, 99 to 2000. So I think a lot of things have happened there. And I'm sure you must also have heard the story of the public health officer who closed the entire police station in Farfanya and has asked all the staff of the police station to vacate because of the poor conditions of the police headquarters. And that was me again. And I want to say that a lot has happened. And then I want to say that colleagues, I want to say that colleagues also need to, also consider that you cannot also enumerate on every function that people do. Like I've seen one of the participants here, that's Solomon P.S. Jata. I'm happy that he was one of the students who came to the School of Public Health, came to Farfanya on practicals. And these are the people we have drilled very well. We have not been sleeping. We do bakery inspection at night from 12 a.m. Up to 5 a.m. And when we close again, we continue straight to the abattoir to start inspection from 6 a.m. to 8 a.m. And then we come back again, take bath and go to the clinic, and then from 8 to 6 p.m. So we have been doing this as a cycle, and people think we didn't have blood in our system, but we have been sacrificing, and we don't have at the time not a very functional motorcycle, and then also not having even allowances for that. But all those sacrifices, we could have been killed during the time that we are doing bakery inspection, because bakery work starts from 12 a.m. to between 12 a.m. to 5 a.m. And this is the time we also do our inspection. We also make sure that all bakeries in Farfanya are inspected on time. So with regards to the border, we have also been what we call doing some cross-border surveillance, and we ensure that we also, because with some of the drugs that were confiscated by the police, it was as a result of our work across the border. We also look at the people also who are entering in and out. Yes, there is a need for the staff to be compensated, to be given some sort of allowance in terms of the cross-border. But that is why the ministry, with support from UNDP to the Japanese project, we were also able to establish what we call the border post at the I don't know whether you've seen that post. We use the border health post at the border in Farafenni, and this is another way of protecting the staff, because that office have both restroom. You also have they can rest there, and they also have an office, and they can also have access to people who are coming in. As you said, yes, they also need to be protected. They need to be motivated. But these are things that were also included in their function. And I think most of the time, before I left the ministry, I think there were also some packages given to border surveillance officers. So those packages, and they may not be adequate in short, but I think that they also need to at least protect themselves. That's why they are given GS, these protective GS at the border, so that when they are doing some of the functions, they also need to put it on. But you'll be surprised that most of those people, when they are working, they don't put on some of those masks, they don't put on masks, they don't put on gloves, because they take it for granted. So I think we're all concerned, but when we are also working in some of those areas, we should also show responsibility in terms of protecting ourselves. But as you said, the issue of the enumeration, I'm sure will also, because some of them have also excelled from that level. Some of them have performed very, very well, and today most of them are also doing very degree programs. Some of them have also got some jobs internationally and are working. So as a result of their hard work, so we just continue to do our hard work. All the work I have done in Farafenni, especially the time I closed a police station, many people thought I'll be arrested. It was at the time that government was very tough, and I think the military government at the time. So I closed a police station. Many people thought I'll be locked, but I closed it, vacated all the. I quarreled with the SO for doing that, because I served a closing order. It wasn't honored. I served again. It wasn't honored, and I have to call the police to say you have to close this place, and it was closed. And I told them to remove all their prisoners from the cell and take it to the nearest police station, and they have done that also. To transfer all their prisoners, and the entire office was closed and for renovation. Because of that work, that Farafenni police station has been fenced, has been renovated, and the women who were there before returned to their base, and they celebrated. They came back, they donated us with gold and everything, and they said they are showing their appreciation, because we imagine in a quarters, people flush their toilet, and you see what you flush, you see it, on the water, and people started walking, on blocks, cement blocks, going to their quarters, for example. And some of these kids, they cannot jump between two blocks, so they have to fall into that water. So that was a concern, and also bat infestation in all the rooms. Women have to get up every day in the morning to clear all the bats, feces of bats, and then try to throw it. So it was a sort of a burden on them. And that was why we closed the police station. But I was commended. After that, that was where everything started. And then I went to Holland from Farafenni directly to Holland to do my course. And then everything started like that. And I was recommended to come to the headquarters to be at the health education unit at the time in 2001. So you can see how things are. So we need to do more and then try to, and yeah, somebody said we need to bring the Cinema Act. Yeah, thank you for information. We are also able to secure World Bank scholarship, World Bank support through a proposal we wrote with some of our colleagues, Sambu and Adam, and attest to that. And we were able to win the grant, and by our directorate, we were able to buy a film van, and the film van is already at the ministry, and then I'm sure they'll start operating very soon, and they'll be using that film van to put some videos, to go around into the community to do community film shows. This is also one of the objectives. And we also have equipment. We have the state-of-the-art equipment in terms of printing, in terms of television coverage, in terms of video cameras. We have all this equipment bought by the World Bank. As a result of the proposal we wrote to World Bank, all those things are there. And then the idea was to have a radio station on our own and also have a film van so that the team will go to the committees, record, and also whilst they are there, we also do the live programming. So all those things were also in the pipeline. And unfortunately, I left, but I'm sure the team is there to continue. But what we do, we start something, others will come and continue. So we don't want to be there throughout in the Ministry of Health throughout our life. I've served for 30 years, and I think that is enough. So the young ones that are there, I am very happy that they are doing very well, and they'll definitely give that directorate a new face, I'm sure, in the long run. Thank you very much. This is so far what I have for now. Thanks.
Okay. Thank you very much, Mr. Njai. That was indeed brave and commendable. Okay, we have this question from Solomon Pesjata. I said we have seen a rise in the proliferation of video clubs with compromised safety. What would you suggest to be our role in improving the standards of our video clubs? So it continues, do we have to bring back the Cinema Act? I think you already touched into that.
Yeah, the Cinema Act is very important, but the video clubs, we need to think about overcrowding, especially when we have an outbreak of a disease that has to do with airborne, for example. We need to definitely work on that. But the video clubs, some of them definitely they need to be closed. And I think, as I said, the public health officers in these districts where we have this video club need to come up with an inspection plan or with a monitoring plan to monitor all the video clubs and to register them. And also time to time to go and see how they're operating. So it depends on the colleagues, and Solomon have trained many people, and I think he was also one time the head of, in fact, still now the head of the Gambia College School of Public Health. And then I'm sure the training will also cover that, and he can also be able to add voice to that, to ask his people, especially those he has trained, to make sure that they do carry out this inspection of video clubs in the areas of jurisdiction. This will really help us. I think I closed 2 video clubs in Farafenni, and I think up to now I don't think they function. And I closed several places, but I was seen as a government opposition at the time. But I said to myself, I better go home, sack, than to allow things happen that are not supposed to happen. And that was my principle, and I thank God I succeeded. And I did the same thing in Sami Karantama, and then I didn't fear it. I had to. When I say it's going to be disposed, it will be disposed. When I say a carcass must be disposed, the carcass must be disposed. And I'm one of the fearless public health officers we had in the country. I didn't fear anything because I said to myself, if I am dismissed, I'll go back home and start doing something else. But if I will want to do my job as it is, as a public health officer. So I think that is why I have that respect, not only because of our work in the public health education or whatever, but because I also ensure that what I'm supposed to do, I will do it. And I was supported to the former president, Jami. I was supported several times to him, and I think he has seen what I'm doing. And later, I was even called by him to say, well, congratulations, well done at the work we have done, especially in Farafenni. I was commended by him during the time that he came there on a presidential tour, because I was able to make sure that Farafenni was clean to the best of its ability. And I think people like Solomon can see that I am one of the fearless public officers in the country. And I think I still maintain that. I don't fear what I'm going to say, and I speak my mind, and I do my job. And then I said bye-bye to the health sector now. So I think my quarter police can pick up from there. Thank you.
Thank you very much, Mr. Njai. Lamin Bisane can go ahead and ask your questions, or if you have any contribution. Go ahead.
Hello, assalamu alaikum to my able director Modou Njai. Modou Njai, Modou Njai is not a new name to me, and We have been working since 2011, and we went for trekking all over the country. Yeah. Okay, my question is Modou Njai, my former director. Like we all see this new birth certificate that is trading right now. What is the comparison between the old one and the new one? For me, in my personal opinion, I was not in support of this new electronical one, because I supported that old one, because this new one, it is not like it is very wide. The page is like, I think if they can even control it, like minimize the size of the new passport. And also, how is it that now the public health officers are in control of this new one again, or it is still under the this sponsor is I don't know whether United Nations or WHO or UN. Yeah, I think it's I don't know the contract between Ministry of Health, public health officers, and those one issuing this new birth certificate. So I want to know, in your own opinion, without nonsense, how I don't know, how do you see these two birth certificates? Yeah.
Thank you very much, Lamin. I think this is a very important question to bring. I was one of the people who were also leading the communication team in terms of the birth registration and the national health insurance. Basically, the new birth certificate came as a result of the challenges we have been having in retrieving the old birth certificate. You remember, in the old birth certificate, we used to have the registers. We have these registers, and these registers, they are in health facilities. So, like for example, the birth register I have been using in Simon Karantaba in 1993, 94, 95, 96, 97. If you go there today, you will not be able to see it. What either the registers are torn, or they have been, they have been kept somewhere, or they have been. So, and that was why we said we need to do what we call electronic birth certificate. To talk about.
Lamin, can you mute, please, Lamin?
It's the same price. In the UK, it's the same
Yes.
Can you mute your mic?
In the UK, it's the same A4 size paper. Yeah, in the UK, it's the same A4 size paper. So the paper doesn't matter. It's the way you carry it. Like, for example, the old one. Some people, when they have it and they want to renew, for example, and they go to Banjul, the registers are nowhere to be seen. I remember that we did a documentary. I don't know whether you've seen the documentary, how the birth certificate unit was before, and then during the time we were able to come up with this new approach. That a complete difference. Because that, with the records, you go to a birth certificate, you know, birth certificate is lost, for example, you go there, you'll be there going up and down between Banjul and Serekunda more than 1 week, 2 weeks before they can be able to locate your register. But now that if you go to the system now, and then your birth certificate is lost, they just go to point your name and and then your name will come up, and they just print it for you and give it to you. And this birth certificate is still at the purview of the Ministry of Health, and the Ministry of Health, the birth registration unit, is the one responsible to ensure that birth certificates are given. And this is also done through the public health officers in the districts. Like, for example, in all the health facilities, major health facilities, we have a district surveillance officer or district public health officers who are also in charge of registration, and they also take this birth certificate also to Banjul for the same process continue. They do all the registration, and also the signing and everything is done also at Banjul. So most of these things are very simple now. So for me, my advice is you can tell your colleagues to keep this birth certificate safe, and then also make sure that they photocopy it, and also they can scan it and put it into their system, so that when it is lost, they just go, that they'll get a name and a number, and they go, and then the ministry will now, they will just try to retrieve it for them. So this is the only way we can be able to keep. But the old one, yes, it is good, but when it is lost at the time, you cannot be able to trace it. And this is why most of them, they say, I've been going to Banjul for my birth certificate, just even to renew it. They say they don't see the register. They do not see the register. Some of the registers I used to work in the birth register up to 1948, 1958 registers. Some of them are there, but those are the British made hard copies. But the ones we started making, they can just talk very easily. So this is why we're having this new system. It's not in everything. Introducing a new system is always a challenge. But I'm sure before people to get to understand it, there'll be a lot of challenges, there'll be a lot of complaints here and there. But when they come to understand, when they come to understand it, definitely it is going to be something that it will be easy for them to have access. What we want to do is we want to make sure access to birth certificate is easy for everyone. And that's why we are trying to decentralize the issue of issuance of birth certificate, like we have been doing before. Before, I used to register in Sami Karantama, and I have a travel to Bansang for it to be endorsed. And I also have a travel to Kuntauru, I know Janjambure again, to do the birth certificate payment, the money that I'm collected to pay, and also keep all the receipts so that when the auditors come, they can also be able to verify that. So the process was so much cumbersome. So for nowadays, I think it's very easy. You can also be able to pass it electronically, and then it will be approved and sent to you again, and you do the printing and give it to them, and whilst they're there. So I think we are making life easy, although some of these things have some challenges here and there. But we also review, like for example, carton. Somebody will always complain the way the carton is pronounced, spelled in the birth certificate is very wrong. We had complaints about that, and I'm sure some of the communities also, they will also have to like for example, some will say Wasadu, the way they spell it on their birth certificate is wrong. They are very right. So we are saying that people need to take these complaints to the central level, and then they will address, because sometimes the way people write the names of the villages are different. So some of these things also affect them. They will say, my document, on my school certificate, the way it is pronounced, spelled there is Katong, it's not the way it is spelled on my birth certificate. So we have those challenges, but this will be solved gradually as we move on. So I expect Lamin to be our ambassador in Fonyi Jarol, to tell his people to get registered. I know him very well. I visited his place and his village, and his people are very nice people, but I wanted him to continue to talk to his people, the people of Fonyi Jarol, to be able to register and to get this stuff. And then let them understand that this registration is not for people to be tracked in Europe to be deported. As people are saying, this birth certificate now is used to track, it will be used to track people to deport them to the Gambia. So let's try to dispel those rumors away from the people that are in our communities. Thank you. Over.
Thank you very much, Mr. Njai. Madam President, you can go ahead and ask your question.
Thank you so much, Isa, for giving me the opportunity once again. Thank you so much. I will call him the Mohammed Gaddafi of the health system. Thank you so much for always fighting for the nation and always being fearless. My question will be, Mr. Njai, you've been somebody who is so experienced, somebody who has traveled almost all over the world. What is the difference between the Gambia healthcare system or the health education and promotion and the other world, like the Gambia? What is the difference? What do we need to improve on exactly? Because I realize there are a lot of difference when it comes to health education and promotion with the Gambia and India, but I only know of India, you know different countries. So what do you think we lack when it comes to health education and promotion in the Gambia, and what do you think we can improve, especially us that are in the health sector area? What is the difference? Thank you.
Thank you very much, Adama. I think basically with regard to health promotion and education, there is a WHO resolution that was released in 2012 in June, and then as a result of that, we had a former Minister of Health, that is Fatim Baji. I know some of you must have known her. She attended that the WHO resolution meeting, and in July she came and set up the Health Promotion Directorate. So we are one of the countries that first started the establishment of a health promotion directorate based on the WHO resolution. And I was identified, the position was advertised, I applied, and I was also be able to give in the job based on my experience and this also qualification in subject matter. But also when we established, it was not easy. Health promotion in general, most of the programs we have threatened that we are going to take their roles and responsibilities, and not knowing that health promotion cuts across all sectors. If you don't work according to that line, you cannot achieve your goals in health promotion. You must have to work across all sectors. And using the whole of government and the whole of society approaches. This is the cardinal principle of health promotion. And we are able to do that. In the Gambia, we are also able to establish a multi-sectoral working group on NCDs, which cuts across all the sectors. That committee was the one that was used as a model by WHO for other countries to start to follow, and because we are able to do that. And then as a result of that, we have also called what is a multi-sectoral working group also on tobacco control. And this committee, we are also able to use that committee to get the tobacco control policy, the tobacco control strategy, the tobacco control act, and also the tobacco control regulation. And our regulation, we are looking at tobacco control as a whole, not living even to say in our act, we are going to say we will we will identify a smoking zone or smoking area. Our tobacco control is 100% compliance. We are not looking at any. So our Tobacco Control Act was also used as a model for other African countries. So that was why myself and Omar Baji were traveling across the continent to support other member countries to establish similar structures. So our directorate was also one of the best in the continent in terms of having the required structure. We were also able to have we created a WASH unit under it. We also, because we is looking at the behavioral related issues, we also look at NCDs, we also look at the school health and also nutrition behavior, nutrition promotion. We also look at communication. So we were able to set up these structures, and this was in line with what WHO recommended. But along the line, politics was used. People were lobbied. People used their lobbying skills just to get some of the programs away from the health promotion director. But we stayed focused. We stayed, consistent, and then we also maintained our name and integrity in the continent. And most of the colleagues, when we meet in meetings, for example, from Latin America, from Asia, from America, we tell them what we have achieved, and we are also happy that anytime we go, we're also able to at least tell people what we have achieved. And that was why the UNICEF and other areas were also able to commend our directorate in terms of bringing open defecation rate to 1% in the country. That was through our achievement as a directorate. And I think up till now, that 1% is still something that the ministry is still struggling. So meaning a lot needs to be done in that area. So we also look at some of the time the NCDs. Again, I'm sure you'll be aware, it's also been removed from health promotion now based on personal interest, based on other things, and they move to another directorate. So thereby killing the functions of the health promotion directorate. So for me, I am somebody who like to protect my roles and responsibilities, and that is why, honestly, I've not been appreciated at all. But I always say, as long as what I'm doing is right and it's also within the confines of my roles and responsibilities, I am focusing on that, and I'm not looking at anything back. And that was why I couldn't stay no longer in the ministry. I had to leave. These are one of the reasons I leave, because I feel that I am supposed to deliver something. I'm not delivering, I leave. So based on what is in India, in terms of sanitation, India is also leading. I don't know whether you know that most of the ideas we have in terms of sanitation, especially the experts in sanitation, experts in wash, are really coming from India. So we also need to learn from that. But when you talk about tobacco control and look at the policy, the guidelines, and then I think as per the WHO resolution, the Gambia is leading in that area. That was why, as I said, we have been identified to support member states, and that was why we travel far and wide to help other countries to establish similar structures. And I think as of now, Omar Baji has been even elected as the African president in terms of tobacco control, and is going to take a delegation of African members to their COP meeting, which is going to be held in Panama next year. So you see, a lot is happening, and I think based on what we have done, our legacies are still there, and they are speaking for ourselves. So we can always say that we initiated this. The Health Promotion Directorate was established. It was with a lot of challenges, with no resources, with no funding, especially when Fatim Baji left. It was difficult. People were not seen as this office as very important. But at least they only considered the directorate when the challenges are there, or when they need to be publicized, or when they want to be publicized, when they want to be recognized by the government. They are for health promotion, and then after that, that's the end of it. And that is something that I said, this has to stop. If we don't fund it, if we don't fund us, don't talk to us about your publicity. And this has been my policy, this has been my principle, and I maintain that. So I think for me, it has been a challenge to lead that place. But from 2012 to 2022, I have been very strong and consistent. So you can realize that at some point, some of you realize that I was one time removed from a national director to a regional director in Farafenni, based on personal sentiments and by one of the ministers. And I went, people thought I'm not going. And I said, I'm not working for any minister, I'm working for the Gambia. So I have to go. And I went to Farafenni. I made significant changes in that place, which was not expected by anybody. One, I established a functional clinic in Darul Liwan. And then because there were a lot of maternal deaths around that area, people who find it difficult, and we had created a clinic, and we also created a clinic in Bambali and Daruli. Some of you, if you know their location, they are very, very far in terms of healthcare service. Today, if anybody goes to Bambali and Daruli, they'll say Modou Njai is one who established that. So that's something, one of my legacies. If I insisted not to go to Farafenye, you think I'm going to get those things done as part of my legacies? No. So therefore, people, when you also return, please, if you are posted or if you are removed based on personal sentiments, please go ahead and move and follow the GO and move. God will be on your way there and you'll come back to your position. Don't fear anyone. Just don't make sure you don't trouble anybody, and then be focused on your job and do not interfere with anybody, do not undermine anybody, any authority, but just focus on your job and let us see God will ever protect you wherever you are. That is my advice to the young ones, especially to you people. You will go back, you deliver to the best of your ability. Don't fear anyone, but also do not undermine any authority, but just make sure that you are doing your work in line with your roles and responsibilities. You'll be protected. Thank you. Oh.
Thank you very much, Mr. Njai, for that wonderful advice. Manima, can you please go ahead and ask your question or any contribution you want to make?
Okay, thank you, Esaso, for giving me the floor to be able to ask my question. Thank you, Mr. Modou. You are such a great guy. Yeah, your contributions are wonderful and amazing. I would like to ask two questions concerning the public health. The first one is concerning the public health. That is the issue of this, that is like the abattoir. At the Abuko abattoir, there was a time that this issue of cow food or cow kanda, we call it locally, where they, according to the health sector, they say most of the heart diseases, disease, cancer, whatsoever, was one of this cow kanda is one of the leading cause of it at the abattoir, and this abattoir were being inspected by the public health sectors, but when after the thing, it's like there was a time that they almost stopped it, but it's like this cow kanda is still going on at that place, whether that place or whatsoever, but the issue of cow kanda is moving. And we were told that, according to information I get, that it was those cow kandas were being, they used to use these tires, that is vehicle tires or whatsoever tires, to hit those cow candies. That is my first question. So what is the move that is being taken to control that, and how is the inspection level at the abattoirs, whether Abuko or any other abattoir? And my second question is concerning about the issue of public smoking. For the public health unit says second-hand smoking is more dangerous than first-hand smoking because there is no filtration done in the second-hand smokers. So how is the issue of public smoking being under control? Whether are you guys, the public health unit, considering it or not? Because almost everyone in the Gambia smokes, whether first-hand smoking, second-hand, or third-hand smoking. So this is the question. Like, this is my doubt. I would like you to clarify it for me. Thank you.
Thank you very much, and if I'm also in Gambia, we will also use as one of our advocates in terms of addressing tobacco issues in the country. But just to start with the question with regards to second-hand smoking, as I said, our tobacco control policy and act and regulation specifically specified that if you are to smoke within the public, you have to be 100 meters away from the next person to you. So, for example, and people will say, this law is very, very comprehensive. This law is very difficult to implement, but we were able to implement it. As I said, even the Tobacco Control Act, we were also stopping some of the seizure, some of the containers were blocked and not being delivered. So because of certain things, and I think, as I said, I don't know whether you listen to my first point. For me, my name, I've been in State House for several times to say this man should be sacked. This man is difficult, but I still maintain that whatever I'm doing is right. So I think at the end of the day, the truth always prevails, and I'm always protected. But when we talk about tobacco control, and then we have been working very hard to get even funding for tobacco control. How do we get it? We have to create an innovative financing. The innovative financing approach we did was like taxation. We were able to increase tobacco control tax, and then we were at the
Mr. Njai?
I think we lost him.
Yeah, I think so. I think so.
Yeah, let me just give him a call. 1 minute, please.
hello, hello, hello.
Hello, Director.
Hello. You are getting me? Sorry, I lost connection. I had a connection challenge. Sorry about that. So I said we were charging per kilo, and now we started charging per packet, and we started with zero amount of money with regards to tobacco tax. But from 2012 to 2021, we were able to get about $450 million on tobacco tax, and that was why Gambia was also seen as a country that is very serious when it comes to tobacco taxation. And because we had a tax modeling approach we have done. So when it comes to the smoking, public smoking, we said if you have to smoke in the act, you have to be 100 meters away from the person next to you. And people said that's difficult. That's a very difficult law to implement. But we said, no, it must be implemented. This was accepted by the former president, signed that law, and then it has been injected by the parliament, have approved it, and then now it is a law. So, and then definitely because of that, we were also able to at least reduce public smoking. Before that, before 2016, people were smoking in vehicles, in vans, drivers were smoking. But now, if somebody smokes in a vehicle, it is the passengers who will tell them you are not supposed, because we have also embarked on aggressive community sensitization on the Tobacco Control Act. People are also aware of their rights in terms of smoking. In those days, you go to the bus stop, people were smoking everywhere. You go to the market. But even one of our colleagues from Kim, last year, before I left, he said, but Modou, people here don't smoke as compared to my country. I say, yeah, because the law is in existence. If you were in the market, you want to smoke within the area, somebody will tell you, hey, please, move on, general fee. Because people are getting aware of. So this will continue. So we'll be happy if you come and join us. We'll also work together in terms of, especially young ones like you, the Caesar, the ones that, because the different flavors in the Caesar. So these flavors are the ones that encourage people to use Caesar. So when you come, you also join them. We also connect you to the ministry, and you also be one of the ambassadors in terms of raising awareness on tobacco. So with regards to abattoir, the management, the operation, the cleanliness for all falls under the management of the livestock Department of Livestock Services. So as you know, especially in Banjul and then also in Brikama and as well as Abuko, all those operations are not public livestock functions. They are the functions of the Department of Livestock Services. And there was what we call there was a board responsible for livestock marketing. So that board also is responsible for that. So, but what we do time to time, public livestock, we go there, do random assessment and say just to see what is happening, and then we also give them recommendations. But when we know that these recommendations are implemented, then we can also be able to apply the Public Health Act and say we need to close, as I did in many places, to close abattoirs. And when you close abattoir, and I think I remember Mr. Bo, I'm sure you must have also heard this story. There was a time I closed all the abattoirs in Farafenye. I closed all the bakeries in Farafenye because we are not satisfied with the way things are. And people say, who is this man who is coming here to tell us that our abattoir, there was no meat and there was also no bread. And the worst of all, the Yai Boy people who are relying on, the way these Yai Boys come to my place, I'm from Badibu also. So I said to myself, I've come to my own area. I'm from Nokunda originally. So I came to my own area. So people thought I'm somebody from different area. And they said, and I told them, I'm not a Surari, I'm a Mandinka like you people, so I'm here to help you people. So basically, this is what it was difficult for me, but I was also able to stand on. So there was no yai boy, there was no bread, and there was no meat because the abattoir was closed, bakeries were closed, and there was no yai boy coming because the yai boy will serve more than 1 month in the store in Kaulak before it is coming to the Gambia. So by the time they come, even you hold it, it's just like you are holding plastic. It's just been moving up and down. So it's almost dead. So I said this one. So they had to change their approach by bringing better Yagoi for us, and also by make sure that all the abattoirs were renovated by the area council, and also all the bakeries were also renovated by the owners. And we were able to get our objective within 1 week. There was no bread in 1 week, and everything. But at the end of the day, we had what we wanted. So it's all about that. It wasn't easy, but the abattoir definitely we still, as you said, we'll still. Also contact my colleagues in Gambia for them to be able to at least work with the livestock department to see how best this abattoirs will improve. With regards to the cow conda, cow conda may be considered the way they are preparing, for example, maybe a cause of concern. But it's also another meat for, like, for example, in Nigeria here, most of the meat is cow conda. You have to rely on that. So it's one of the best food people eat a lot. So in Sierra Leone, most of the food cow condas are exported to Sierra Leone, Ghana, Burkina Faso, and then maybe Nigeria at some point. So they have just been processed and also sent for other final processing and then and the distribution in those countries. So what we also need to do as public health officers is to give them guidance as to what they are supposed to do. And then I think this is something that we perhaps when you come back, when you return to the Gambia, like me, someone or others are here, they can also be able to link you to the various units. And then, because we are talking about partnership, collaboration, and networking within the health sector. So we are looking for more partners. So having you, even not in the area of health, but at least will also be useful in trying to achieve our objectives in those areas. Thank you. Over.
Thank you very much, Mr. Njai, and thank you very much, Manima, for that wonderful. Can we have Mr. Njai? Njai, you can go ahead and ask your question if you have any.
Yes, thank you. Thank you very much for coming again. Thank you to our able, I call him veteran, listening to his speech or his deliberation, you will realize he was a real guy there. And I'm a living witness in those days in Karantawasame, as he stated. Everyone knows him, everyone. And that was a fact, because of the good job he was doing. So my question would be, or my contribution here would be, what advice would you have for us, the youth? Some of us that might not be ready to sacrifice to the government like you did. What do you have for us? We have some science students, we have other fields, but going to government, serving in a difficult condition, what would you advise some of us that are coming up or graduating in the next few years and joining the system or ready to join the system to indeed serve? I'm ready to serve for the government and serve your people. What would you advise? Like you did actually, because you have definitely done a great job for serving people and people's lives. So what advice would you have for the youth or for us graduating in a few years to come? Thank you.
Thank you, Njai. This is a very important thing. Basically, let's just try to learn along the way. After graduation, let's not see ourselves as people who know everything. We are just from the university. And that most of it, that's the mistake of other people. As my colleague will say, I am one of the few food directors who will accept to work with everybody, no matter what training you have. But people also feel threatened to work with graduates because they feel, me, I'm a degree bachelor's holder, I'm a doctorate diploma holder, and this guy is coming as a master's holder, and then I'm a feel threatened about that. So I don't think I can be able to accommodate this person. This has been a challenge to many people. But I want to say that when you graduate, kindly go back to your ministry. Do not overstay where you are. One, do not also quit wherever you are. Try to, because you're already on settlement, or maybe you're on study leave with salary, for example, or you're on study leave, or government have given you some opportunity. So please go back and serve the government. Wherever they take you on postings, please go. Serve the people. Serve the people to the best of your ability. When those people say to you, Abaraka, Jerejev, on Jarama, on a daily basis, that is enough for you. The money is important. As I tell you, when I was in Islamic Kingdom, I was paid $950. $950. That was my salary, including everything. $950. But I was able to manage that. I was able to get 2 bags of rice every month, which I buy I was not married at the time. I buy and put it in my house. Anybody who comes to me, especially at night, they come around 10, 11 at night. I have nothing to eat tomorrow. I say, go and enter and measure whatever you want to measure. And the moment that finished, I replace it again. That was what I did for 4 years, complete non-stop. And the moment they say, Baraka, Jerejef Njarama, that's enough. In Same area, I have more than about 20 namesakes. I don't know them. Some of them, they come to clinic. They have nowhere to stay. I leave my house for them. I go and sleep outside. That's why I'm used to sleeping outside, sleeping under the veranda, because I'm used to that. Up till now, sometimes to sleep in the house is difficult. I'm used to sleeping outside. Just be kind to people. Be open to whatever small dollars you have. You have $20. If somebody comes to you and tell you today, I'm going to Mr. Bamara, I'm going to Nyamanari. From Fatoto, I'm admitted to the health center. But we are going to Nyamanari tomorrow and we don't have fare. If you have $100 and the fare is $100, please give $100 if you can. Be brave enough to give. And by the time you give and get back to your house, I'm sure somebody also will give you something more than that. Just give out whatever you have. Try to help the people. And when you you are working under somebody, don't undermine any of your authorities. Be supportive to your superiors. Guide them. And at some point, chip in when they're discussing technical issues. You chip in. And then give your opinion, and then you stop at that. And as time goes on, anytime they're discussing, they will say, yeah, where's Abdullah? Or where's Kante, Yoro? Or where's so-and-so? They start calling you and say, can you come and join us? Let's share your experience. That's the way they will integrate you gradually, until you become a master. As you learn, you also try to connect with other stakeholders, other ministries, connect with other key people. Connect in the sense that try to show them your skills, try to show them what you can do, and try to also accept that you're also learning from them. This will give you the opportunities. And as I'm also telling you, as you are also graduating at a bachelor's level, go back, don't stop at that bachelor's level. Please work on having a master's degree, work on having a PhD. That will also help you a lot in terms of your academic achievement. All my scholarships, I will tell you, I was not sponsored by government. I was not sponsored by the Minister of Health. All the trainings I did in Holland, I was sponsored by the Netherlands government scholarship program. My master's program in the UK, I was sponsored by the World Bank Joint Japan Graduate Scholarship Program. And up till now, I'm an alumni of that program. And I still serve as a reference for other people in that particular program. And definitely, I did for 3 people this year, and all of them got their scholarship, and they're currently pursuing their master's programs in one of them in Holland, one of the UK, and the other one I think is somewhere in one of the African countries. So I'm an alumni of that of that program. They call it the World Bank Joint Japan Graduate Scholarship Program. You can also Google into that. But as you Google also, they also have their secret. I'll tell you this today. I'm not going to hide anything from you. They have their secret. The secret is you must have to get a school within the schools that they are supporting or working with in the continent, in the world. It could be the African continent, Asia, Latin America, Australia, whatever. These schools, how you get to know, you also type in Google list of schools or list of universities affiliated or supported by World Bank Joint Japan Graduate Scholarship Program. All this list will come for you. And you choose those schools. Try to get 3 admissions. 3 admission letters, if possible 2, with an evidence of communication with another 3rd one. And you start working on applying for the World Bank Joint Japan Graduate Scholarship Program. And then when you apply it, you attach all your acceptance letters for schools that they are interested in. When they look at that, they know this guy knows what they want. And this man, this person needs business. And then you apply. The application process opens between March to May every year. So try to apply it. It's starting from March, and make sure you submit before 31st of May every year. So, and then I am sure those people who have done it, I'm more than willing and happy to be a reference to any one of you who want me to be a reference when you get when you're applying for the World Bank Joint Japan Graduate Scholarship Program. And they're into social development, they're into health, they're into economic development, they're into finance, they're into road construction, they're into so many projects. All other development programs supported by World Bank in our countries, they're into all those programs in the as supporting program. But they only support graduate programs. That's why they call it World Bank Graduate Scholarship Program. So they also, and their allowance is good. At least no matter what, I was staying in the UK with my family, and I think it was also taking us. So please work on that. Whilst you're also working, and wherever they post, I'm sure some of you, if you are working in the agricultural sector, they might post you to Sapo. If you go to Sapo or Kuntauru, these are demonstration sites. They want you to at least to show your skills in terms of rice cultivation, rice production, rice management, or maybe modification, rice modification, and so on. They're telling you on that. Go there and learn your skills. Don't say that place don't have electricity. That's electricity now. They have generator, and then also they are also connected to the electricity grid. But also, don't say that it's far away because Sapo is far from Brikama. You want to go and enjoy yourself. You want to have your drink. You want to have your boyfriend. You want to have your girlfriend very close to you, and you want to be in Bansang. You want to be driving an expensive car. You want to have your own private car. Forget about all those luxurious life for now. Until you develop yourself, you got your degrees, you got your farm, then you get married. If you are young, as long as 20, 23, 24, 25, get married. Don't waste your time. Whatever you don't get, your children might get it for you in the long run. So get married as early as you can whilst you are working, and then make sure that whenever they post you, please go. Don't resist on postings. If you go to PMO today, the chairperson of the Public Service Commission will always make me as an example. Somebody even told me last week, one director was moved and the director, and they were making me as an example that I was a national director. I was moved and I accepted in good faith. I even demanded for a vehicle to come the following day for me to go to and report to my station. So I was made as an example. So don't ever resist on postings. You never know what is coming on your way on postings. That is my advice. When you go, please, please, please accept anything that comes on your way. Do not challenge authority. Do not challenge your bosses. Respect them, but never, never be gossiping your boss, and never, never be a party to people who will also be there to gossip and also undermine your boss. I don't know whether you are saying, don't ever trust anybody. That is my thing. Because Gambia, the honest thing is don't trust anybody. Just be focused on your own. If you want, you can be, in Manika we say, Kunkin Tamala. If you want, you can do that in Gambia. But the Gambian situation is getting worse now. Even the people you tell some few things, the next minute they turn it into a different story. That's my advice. So take note of that. Thank you.
Thank you very much for such a brilliant advice. I will take note of it. Mr. Lamin Sambu, can you please come and give one word or two? Mr. Lamin Sambu. Is Mr. Lamin Sambu around?
We can move ahead if he's not available.
Okay, it seems like he's not around. Okay. Do you have anyone who wants to ask a question or make any contribution? Okay, Manimat, you can go ahead. Please try and make it brief as time is not on our side.
Okay, thank you again for allowing me in. I'm still going back to Mr. Modou. Concerning that about the issue of that cow and the years, when we went to the abattoir, like we asked, there were different kind of it. Some were black, some were white, and like a bit, like some were a bit cool, and you prefer those ones. So when we asked this man, how much is this cow, and he was like, "Duma be he Guinea." Although is it Sierra Leone? He was giving me list of countries that those ones we are going. So this one that was a kind of black, and when we asked him this one, he said this one was going to Serekunda market. So my friend was like, is it that these people like these ones that are good and okay, and those ones were being preserved because the flies were not standing on them, they were covered and okay. It's the ones they export. So it was kind of like the one they need to export, they take proper care of it and everything is fine. And in fact, the colors were fine. Okay, it was eye-catching, like it's a bit attractive compared to the ones that were so in the Gambia. So when we see for her, she continued asking because I left there. But what she told me was like, those that are living in the Gambia, according to the man, because there were a bit of language barrier for her, she can only speak Wolof, and that man was fluent in Fula and Maninga. But according to her, what that one says, like, if those ones are not kept fine when they are exported, the price that the price that they buy them for is very small. So that means they need to keep them okay and let them be fresh so that they can get a good quality price for it. Meaning like the product goes with the price of the product. So it's like in the Gambia, what we are maintaining there is not high. We don't consider the hygienic level of it or other stuff related to it as compared to the one that they export out of the Gambia. So that's a bit kind of crazy too.
Thank you, Manyima. Manyima, where do you come from? Manyima.
I am a Kianga. I'm a Kianga.
Kianga from where? Which part of Kiang?
From
Kiang West or
Kiang
Kiang East? Okay,
I don't
that's
know,
Kiang
but I'm
West.
from Kiang Janakunda.
I know it's Kiang West. Janakunda is just close to Joli, and then you have Karantaba, and then yeah. So you are right. So for example, let me give you one example from Janakunda, or maybe Karantaba or Joli. During the time that people are doing vegetable production, and then they wake up very early in the morning, 4 a.m. with the materials from Kiang to go to Brikama to sell their things. But in the evening when they come from the garden, you know what they do? They select all the best part of the food that they are selling, and then leave the Jaba Jamba tolerable Mengo Norota. You know, I'm just speaking to the local language now. Jaba Jamba Menga Norota, Jabo Menga Fasata, Jato Menga Norota Fasata. Those are the ones that they kept for the household consumption. And the best ones are selected to be sold at the Brikama market, so that by the time they go, it are fine and they come and sell that. Those are people, they will be sold immediately. Likewise, groundnut. They take the best ones of the groundnut and sell it. And then the bad ones are the ones that live te Noro Lambang, te Fasar Lambang, and then te Safuno Jamajamo Lago de Sokon. Those are the ones they keep at home. Basically. So this is the truth. Cassava also the same thing. They produce cassava. The best ones are the ones they say. It's the attitude of the government people. This is why you and I need to work alone around that. That our work in those days was focused on one. Don't sell only those ones that are good. But even the ones that we are selecting to be the best one, please take part of that, portion of that, and eat that, and throw away the ones that are not good. That has been our message throughout. But it has been a challenge. So I will also advise my colleagues in the health sector who are still here. They can also liaise with the livestock counterparts, and they also carry out at some point rapid assessment, or maybe they can just at some point ad hoc visit in these areas, and definitely work on according to what Manyima is saying. And I think these are elements of fact in it. Most of the time, the bad ones are the ones that we leave, we sell to our own people, and the best ones are the ones we also prepare for export. But that's why I give this scenario to her. Like I was, brought up in a village life, and when my mother used to go for selling in those, they have to sell. They would call us to come and select the best ones. And when we do the selection, and those are the ones they take, and the bad ones are the ones that they leave for us to consume. So I think we have a lot of work to do when we go back. Manyima and team, and I'm sure with time we will connect together, and then we will go back home. And also, I'm not intending to stay back here for some time, but at least I will go back to the health sector. And then whilst we are there, by the time you graduate, we also work. But before graduation, I'm sure Solomon and other teams are here. The guys still in touch with colleagues around Abuko Health Facility or maybe Fajikunda Health Center. They can also come up with a team. The team can also be able to now to do some of the assessments. So Manyima can liaise with our colleagues in the Solomon. They can also be able to tell you who are those people at Fajikunda Health Center, and that they can be able to embark on some of this assessment in there. So, but thank you for bringing up this idea. But I also gave a scenario that in Gambia, the worst thing, the bad things, the bad foods are the one that we consume, and the best ones are the one we sell to the public. And I think this is I don't know whether some people from the village can attest to this. I'm sure Mr. Mo is from village, Abdullah is from the village, and Khadija may be also a village lady, so maybe they can also attest to this. And Lamin San from Jarol. I'm sure in Jarol those days, even the best melon right now, they are the ones on the highway, and the bad ones are the ones they have at home, and they start. I think I saw Almami Kamara of doing that. So Alamin knows what I'm talking about, and Jarol, they will see the same thing in the Fonyi Kalaji. You'll see the same thing. I mean, so this I think Kamamudu, you see the same thing there. So I think these our colleagues can also share their experience in this. But this is the truth about Gambia. You go to Gunjur side also, the best ones, the cassavas, the garden egg and everything, the best ones are the ones they sell, because they will say these are the fresh ones and this is what people will like and this is what people are going to buy. And the worst ones are the ones that are kept at home for our consumption. So we need to change from that. Thank you.
Thank you very much, Mr. Njai.
Somebody's saying how best can they get in contact with me? My WhatsApp is still working. I think Adama has my WhatsApp, but I can still give you +220 200 2851. I still love the Gambia, and I don't have a Nigerian line, but I still have my +220 200 2851. That is still my number, which is on WhatsApp. So I still love my Gambian number. So I'm still Gambian. Okay, that's my contact. And my email is there. So Njai M, in capital N, Njai, capital M, at africacdc.org. Njai M, let me just type it for you people to see. And you can communicate to me anytime you want to. Have you seen it? Yeah. Okay, thanks. Thank you. Okay, over to you, Chairman.
Oh, thank you so much, Mr. Njai. Time is not even on our side because the meeting was supposed to close about 30 minutes ago. So I would now like to call on the Assistant PRS to give the closing remarks. Wagi, you can go ahead.
Okay, sir. Okay.
Good evening, everyone. I am Modou Njai, the Assistant PRS of the Association of Gambian Students in India, as Asa rightly mentioned. And thank you so much, Asa, for giving me the floor to come up with the closing remark for this very awesome webinar. Okay, so as we draw the curtains on this enlightening webinar, we extend our heartfelt gratitude to Mr. Modou Njai, our esteemed guest speaker, for sharing these profound insights on the importance of health education in enhancing primary health care access in the Gambia. Sir, your expertise has illuminated our understanding and inspired us towards a healthier and more informed future. And also to our dedicated attendees, thank you for your active participation. Let this event serve as a catalyst for positive change and a renewed commitment to advancing our health education in our beloved nation, the Gambia. And thank you so much. That will be all.
Thank you so much. Thank you, everybody, for attending. Thank you, Director.
Thank you very much, Adam. Thank you all. Thank you. I'm so grateful.
Thank you. We are grateful having you here.
Thank you.